Hello everyone, I'm Dr. Subrata Dey, pioneer pediatric endocrinologist associated with Neotia Women and Children's Hospital for the last 15 years. Today's topic will be on congenital hypothyroidism and newborn screening. The most important, treatable and preventable cause of mental retardation in children is congenital hypothyroidism. However, in the early days, the signs and symptoms are very subtle. And by the time the features of prolonged jaundice, coarse faces, slow hoarse cry, protruding abdomen comes up, already the damage to the brain has happened. The brain growth is extremely dependent on the levels of thyroxine hormone in the body. This is a fairly common condition. 1 in 2,000 live babies have been detected to have congenital hypothyroidism, and it is important to detect them early. At our Neotia Women's and Children's Hospital, we do a cord blood TSH so that the results are available. If it is high, then repeat blood samples from the baby are done after 3 days, and due judgment is made as to whether to treat or not treat. There is also another safety feature. At 72 hours of age, after a baby is on full feed, something called a newborn screening or neonatal panel is sent for 6 to 7 common conditions with 1 drop of blood, and the results are back usually in 10 days. There also congenital hypothyroidism can be picked up, and it is imperative that the diagnosis is made and treatment started before 2 weeks of age. Brain maturity is directly proportional to the level of thyroxine, and the greater the delay in diagnosing congenital hypothyroidism, worse is the ultimate intellectual outcome. What we do is, as soon as we have abnormal results, we don't wait, we do an ultrasound and we do 99 technetium scanning, establish the diagnosis, whether it is an absent thyroid gland or is it an ectopic thyroid gland or a gland which is present but malfunctioning. Now, this treatment typically is for lifelong in those babies whose thyroid gland is either missing or small or in the wrong position. Many children, however, can be taken off the medication around 3 years of age, when almost significant amount of brain development has happened, and then we retest. We stop the medication, especially if it's on low dose, and retest and see if the TSH is high. Then we have to restart. If it is still normal, then we can gradually release this child from follow-up. The most important message is that hypothyroidism at birth can be missed. It is very subtle, and so it is extremely important that the newborn screening, which is present at Neotia in 2 layers, be happening in every hospital in the country, every part of the country, and we should have universal newborn screening as a policy. So I want to conclude by saying that if detected at the right time and the medication is given and the tests are done as per protocol, the brain growth will be totally intact and the development will be normal. Conversely, if it is missed, then the IQ deteriorates rapidly, and those babies who have been picked up late at 6 months or 8 months or 10 months have moderate to severe mental retardation going forward. So the final word is, the most common preventable cause of mental retardation is congenital hypothyroidism, and it can be detected by newborn screening. Thank you so much. This has been the protocol at Nevartia and most other private sector hospitals. However, this should become universal, and parents should be aware, especially would-be parents, that this test they must insist on, when the baby is born. Thank you for your patient listening.